Doctor, I feel something strange in my head that I can't really explain.
It's like I'm always drunk, but without having had anything to drink.
I feel like I'm going to fall, but I never do, and my head feels empty.
If you've ever said something like this to a doctor and they didn't know what it was, this video is for you, because in the next 10 minutes, I'm going to explain all the signs and symptoms of PPPD. Persistent Postural-Perceptual Dizziness, the main cause of chronic dizziness. I'm going to break it down into 4 groups so you can understand exactly what's happening in your body and why it's so hard to explain to others. I'm Dr. Saulo Nader, a neurologist specializing in vestibular and balance disorders, also known as Dr. Dizziness. And folks, every day I see patients who feel misunderstood, who have already seen several doctors without being able to properly explain what they're feeling. Because PPPD causes very specific and characteristic symptoms, and when you understand these patterns, then everything starts to make sense. For those who don't know what PPPD is, the symptoms seem vague, random, like something that really shouldn't even be possible. I'm going to organize this in a clear way so you can recognize exactly what's going on. But before we start, I need a favor. As I describe the symptoms, if you identify with any of them, type "I relate" in the comments. You don't need to specify which symptom, okay? Just those 2 words, because I want you to really commit to paying attention during these 10 minutes. Each symptom I describe could be the key for you to finally understand what you have and seek the right treatment. Let's start with the first group of symptoms. The first group is strange sensations in the head, unspecified cephalic sensations. These are the symptoms most often reported by my patients with PPPD, and I'll give you some examples. An empty or hollow head, as if there were an empty space inside the head, like a deflated balloon. Many describe it as a windy head, confused head, or foggy head, a sensation of having cotton, fog, or clouds inside the head. Difficulty having clear thoughts, as if you're always in a state of mild drowsiness. A sensation of pressure, as if wearing a tight helmet, a heavy hat, or a band wrapped around the head. Some people feel, believe it or not, as if their head is about to explode, or a head that feels either too heavy or too light. An alternation between feeling the head is extremely heavy, hard to hold up, or too light, for example, as if it might float away. A sensation of a permanent hangover. Here's another one, okay? Exactly like an alcohol hangover, but constant. And then, of course, right? Without the person having drunk anything. That feeling of general discomfort in the head. All right, so now let's move on to the second group. The second group is the group of instability and imbalance. These symptoms directly affect how you move and feel in space. So instability while walking, a feeling of always being off balance as if you're walking on a boat or in quicksand. The person has to really concentrate to walk in a straight line, a constant fear of falling. You live with the worry of losing your balance and falling, even if you've never actually fallen because of the dizziness. It's an irrational fear, but it feels very real. A need for support. Instinctively, you look for walls, furniture, or handrails to hold on to, even when you're not actually losing your balance. A sensation of floating. It's as if you're floating, disconnected from the ground, not really feeling where your feet touch the floor. Postural insecurity. It's a particular discomfort when standing still. You feel safer sitting or lying down, and very insecure when you have to stand, especially when standing still. Difficulty with stairs and ramps. These environments seem especially challenging, making you feel much more insecure than usual. And if up to this point you've already identified with several symptoms, remember our agreement, okay? Type "I identified" in the comments and keep paying attention here with me, okay? There are still 2 important groups left. Often it's actually the combination of symptoms from different groups that confirms the diagnosis of PPPD. So let's go to the third group. These are visual and environmental triggers. These are the symptoms that get worse in specific situations related to what you see. For example, symptoms worsen in supermarkets and shopping malls. So the aisles, the crowded shelves, the movement of people. All of this greatly intensifies your symptoms. This is one of the most commonly reported triggers. Discomfort with screens, cell phones, computers, and TVs can make your symptoms worse. Scrolling quickly through your feed on your phone or social media, especially when there's screen movement or when you need to scroll through pages. Discomfort in crowds, environments with lots of people moving around and a lot of simultaneous visual stimulation also worsen the symptoms. Sensitivity to visual patterns, for example, checkered floors, stripes, or complex geometric patterns can cause visual discomfort and worsen dizziness. We often see this, right, in hotels and carpets. Difficulty driving, especially at night, in the rain or on busy roads, dynamic visual stimulation worsens the symptoms. Discomfort in large environments, big parking lots, large churches, or very open spaces can cause insecurity and worsen the symptoms. And finally, the fourth group, which are the positional and movement triggers. These symptoms are related to your position in space and the movements your body makes. So, for example, worsening when standing up. The symptoms are always more intense when you are standing, especially when standing still, and a significant improvement when sitting or lying down. Sensitivity to head movement, so quick head movements, looking up to the sides can momentarily intensify the symptoms. Discomfort in transportation, so on the bus, in the car, especially when you're a passenger, this can worsen the symptoms due to the passive movement of your body. Walking gets worse. This is very common, by the way. When you walk, the symptoms intensify even more, so long walks become very uncomfortable. Difficulty with changes in position, such as getting up from bed, from a chair, squatting down, or standing up. When other people move around you or objects move within your visual field, your symptoms can get worse. And now we've finished the 4 groups. And now that you know these 4 groups, I've brought some general characteristics that differentiate PPPD from other types of dizziness. You want to know a very important characteristic? Persistence. Remember that the name is Persistent Postural-Perceptual Dizziness? Persistent. The symptoms are present most of the time, every day or almost every day for at least 3 months. They are not episodes that come and go completely. So the dizziness comes and it stays. Variation in intensity. Although always present, the symptoms vary in intensity throughout the day and from day to day, so there can be better days and worse days. There is a fluctuation in the intensity of the symptoms. Difficulty describing it. You have trouble explaining, telling people, relatives, friends, or your healthcare professional exactly what you feel. It's hard to put into words, and people don't understand when you try to describe it. Impact on quality of life. The symptoms greatly affect your daily activities, work, and social life. If you avoid situations that used to be normal for you, normal tests, MRIs, ear exams, blood tests, they always come back normal, which leads to frustration and misunderstanding. If you identified with symptoms from several groups, especially if this has lasted for more than 3 months, there is a chance you have PPPD. The next step, look for a doctor with expertise in dizziness and bring a list of which symptoms you have from each group. This helps a lot with the diagnosis. And remember, you're not imagining things. PPD is a real neurological condition with very specific symptoms. There is treatment and you can get better. If this video has finally put a name to what you're feeling, share it with your family and friends. They need to understand that your symptoms are real and that there is a medical explanation for them. And if you typed "I identify," now also type "I will seek help" to commit to the next step in your recovery journey. Stop being silly and follow me here. Are you going again? Again? It is not possible. There's nothing else to do. Feeling? I think I said it wrong. Okay, come back again. Didactics for you. I think he'll appear in the video, right?
It's rolling.
Then go ahead. All of this intensifies significantly. That's a really bad word to have on the teleprompter. Stop being dumb.